Okay, so welcome to the next module on cellular adaptations. So how do cells adapt to different environments and what happens to cells, as well as cellular injury. So there's a number of ways that cells can become injured in the body, and we're going to discuss many of those processes and how the body deals with cellular injury. Okay, so it's very important for cells to be able to adapt to changing environments. So even though we've discussed the concept of homeostasis and how important it is for the body to try and maintain homeostasis, such as maintaining very tight parameters for your pH or for your blood pressure or for electrolytes such as sodium and potassium and chloride and other electrolytes. The body is constantly trying to keep the environment the same, but that's not always possible. So cells need to have some adaptability. Okay? And how do cells adapt to changes in their environment? Well, they can modify their metabolism, or they can modify the way that they're growing. And we'll come to that. Okay? Now, environmental changes can be physiological. So say, for example, it's extremely hot outside. So it happens to be a day where it's 102 degrees. The body needs to adapt to that change in temperature, and it's going to find ways to maintain body temperature despite the fact that the temperature in the environment is 102 or 103. Okay? Or say, for example, the body develops a hemorrhage in the bowel. So the patient is having a rectal bleed, right? From, say, a peptic ulcer in their stomach. Well, that's a pathological disease, the peptic ulcer, that's now bleeding. The body is going to have to adapt very quickly to that change, because now the patient's become hypotensive, tachycardic, and the body's very quickly going to adapt to try and maintain blood pressure in the body. Okay. We also spoke about cells that need to adapt under different environmental conditions or under different tissue conditions. So a perfect example of that is where a patient has acid that's refluxing from their stomach into their esophagus and causing inflammation of the esophagus, what we call a heartburn or gastroesophageal reflux disease. And the cells at the lower esophagus are being irritated. Okay, they're just squamous epithelium. So they're going to need to adapt to a different type of cell, more of a columnar epithelial cell, to have more protection from the acid. Okay, so that's an example of a pathological disease that has led to cells having to adapt. Okay, so through this cellular adaptation, it can allow the tissue to survive or maintain its function in very different environments. Okay, so if the cell was to remain exactly the same in a different environment, that particular environment might be too hostile for it, or it might damage the membrane of the cell. Okay, so here's some cellular adaptations. So atrophy. So atrophy just means shrinkage of the size of the cells. Okay, and an example of that is someone who lies in bed for days. So this is typically an older person that's been lying in bed, say after a pelvic fracture or a hip fracture. And what's going to happen to their muscles? They're going to atrophy. They're going to shrink in size. Okay? In fact, patients over the age of 75 years old, every day they lie in bed, they lose 1% of their muscle mass per day. So that's why we typically get patients up quickly after an illness or after a surgery. Okay, so atrophy is referring to shrinkage of cells. Okay, and we usually use the term muscular atrophy or muscle atrophy. And we become very concerned about this if someone is just laying in bed for days and days. Okay, they get a number of other conditions as well. They can get ulcers on their skin. They can develop blood clots in their legs. But we're talking about muscle atrophy here. So I'm going to try and add some more detail to things as we go along. But I'll always come back to what we're talking about. Okay, so hypertrophy is just enlargement of the cells. And enlargement of the cell is not that the cell has produced many more cells, it's just that each individual cell is now larger. And I'll give you an example of that. So muscle cells, again, can hypertrophy if they're used more. So if someone decides to go into a fitness program and they're running regularly, well, they're going to get hypertrophy of their muscle cells. Okay? What if your heart has to pump against a higher blood pressure for months to years? You're going to get hypertrophy of the muscle cells of the heart. Okay? So myocardial hypertrophy, enlargement of the muscle cells of the heart. Hyperplasia just means an increased number of cells. So they haven't necessarily gotten smaller or bigger, there's just more of them. They become hyperplastic. Metaplasia means that the cell has changed to another shape or has adapted in another way to protect itself. And a perfect example of a metaplastic change is, say, the lower esophagus that initially has changed from a squamous epithelium to a columnar epithelium to protect itself from the acid that's washing up during heartburn or reflux disease. Dysplastic changes to a cell typically mean abnormal cell shape, and invariably it means that the cells are becoming precancerous. So we spoke about HPV that can cause dysplastic cells in the cervix, and then those dysplastic cells are precancerous and they can lead to cancer years later. Well, you can get dysplastic cells in your lower esophagus from the acid irritating those cells over months to years. Okay, so that is a risk factor for reflux esophagitis, that you develop dysplastic cells in your lower esophagus that could become esophageal cancer. Okay, you can have dysplastic moles on your skin, and if you have a dysplastic mole, that is a risk factor for developing malignant melanoma, which is an aggressive skin cancer. Okay, so dysplastic would be the most concerning one there that could turn into cancer. Okay, so here's some examples of what we were just talking about. So say the top line is just normal appearing cuboidal cells, and then below it is an example of atrophy or cell shrinkage. Okay, and we use the example of muscle atrophy during disuse from lying in bed. Hypertrophy, so someone decides to start weightlifting, the muscle cells are going to hypertrophy. Hyperplasia is rapid division of cells. The gastrointestinal tract often has to rapidly divide cells because it's often losing so many cells. So the skin is another example where you're constantly shedding skin cells. So sometimes the skin cells have to become hyperplastic, produce skin cells faster. Okay? Metaplasia is basically just a change in the type of cell, and typically to protect the cell. And dysplasia is typically abnormal appearing cells that are often precancerous. Okay, and we spoke about cervical dysplasia and lower esophageal dysplasia of the cells. You can have dysplastic cells basically anywhere. Okay, someone could have a colonoscopy and have some polyps removed, and they may have dysplastic polyps. It doesn't mean they have cancer. It means that they had precancerous cells on the polyps. Okay. Okay, so just another slide, another way to view it. So you have normal cells in the middle. They have the ability to atrophy, to shrink. They have the ability to hypertrophy and grow larger. Hyperplasia is division of the cells or increased division of the cells. Metaplasia is changing the shape of the cells, not typically precancerous though. And hyperplasia is increased division of the cells. And these are all just cellular changes. The one that really is precancerous is dysplasia. And whenever you have a cell that's either rapidly dividing or changing its shape, there is a small risk of leading to dysplasia. So that's why tissues around the body that rapidly divide are more prone for the cell to make a mistake. So in those millions and millions of divisions that have taken place in your skin, in your thyroid gland, in your breasts, in your gastrointestinal tract, there can be an error in mitosis, right? So when you have rapidly dividing cells, they can lead to a mutation and finally dysplasia. And that's why we see a lot of gastrointestinal tumors. We see breast cancers. We see thyroid cancers. We see skin cancers. And we see bone marrow cancers. And that is all because those are areas of rapid division. So they would be much more common than, say, a brain tumor or a kidney tumor, because they're not dividing as rapidly. They're not prone to making a division error that can lead to a cancer or lead to dysplasia. Okay, so just a bit of information on why those arrows are leading from hyperplasia and metaplasia to dysplasia. Okay, so let's start talking about atrophy of cells. And there's a number of causes of atrophy of cells. So disuse being one of them, right? So decreased workload, decreased physical activity, bedbound is all going to lead to muscle disuse and muscle cell atrophy. Denervation of muscles. So if someone's had a stroke, the nerves are no longer working to the muscles aren't being contracted, so they're not being used, and they're going to atrophy. So say for example somebody has a stroke that's paralyzed their right arm and right leg, and the nerve is unable to stimulate the muscle any longer. Well, the arm and the leg is not going to be used, it's not going to be stimulated, and it's going to lead to muscular atrophy, okay, through denervation. Loss of endocrine stimulation. So a perfect example of that is at menopause, where women around the age of 50 in North America go through menopause, where they stop producing estrogen and progesterone from their ovaries. Estrogen and progesterone promote cell growth and maintain cellular structure, especially of the breasts and the vagina and all the sexual organs. So the uterus, the vagina. So with the loss of those hormones, you're going to have atrophy of certain parts of the body. Okay? Inadequate nutrition. So lack of nutrition in terms of your diet is going to lead to atrophy of certain cells because they're not getting the proper food requirements. Okay, so and again, muscle would be a perfect example of that, where if it's not getting the appropriate nutrition, the muscle cells will atrophy, not only because the person is weak and not able to maintain physical activity, it's because also the muscle cells are not being provided with proper nutrition. Okay, and a big one, ischemia. Okay, we're going to spend some time on ischemia. So whenever an area of the body is lacking oxygen, whether it's from a blocked blood vessel to the area that can't deliver the oxygen, or whether it's from a lung disease where not enough oxygen is getting into the blood. So even though the blood can get to the area, it still has low oxygen in it. We call that ischemia, okay? And with ischemia, you get atrophy of cells because they're not being provided with the proper amount of oxygen. Okay, so just another slide on atrophy. Let's just look at the bottom, the 4 items listed though. So really when we're thinking of atrophy, we're thinking of prolonged bed rest leading to muscular atrophy, disuse of limbs, say from a stroke, can lead to atrophy, which really isn't reversible because the nerve damage isn't reversible after a stroke, right? Poor tissue nutrition will lead to atrophy because the cellular metabolism has dropped, right? So the cells aren't producing as much, so they're shrinking. And of course, ischemia, which is either lack of oxygen in the bloodstream throughout the whole body, or lack of oxygen to one part of the body, such as the heart or the kidney or the brain, because of a blocked artery to that particular organ. Okay, so you can have ischemia to a leg, you can have ischemia to your heart, you can have ischemia to your brain or your kidney from a blocked artery. But when we're talking about low oxygen in the blood as a whole, we're gonna call it hypoxemia. Okay, so hypoxemia is low oxygen in the bloodstream, and it's typically from lung disease such as COPD and inability to bring oxygen into the bloodstream. Okay? You can have local ischemia or local hypoxemia, or another term, local hypoxia, which means in one area of the body, say your left leg, you have hypoxia of the cells because the artery is blocked that's feeding the leg. Okay, so hypoxia is at the cellular level. Hypoxemia means the blood as a whole has low oxygen. Okay? Okay, what about hypertrophy of cells? So hypertrophy is enlargement, and that can definitely be a physiological change or adaptation, right? So you start using muscles more, you start running more, or you start swimming more, you're going to get hypertrophy of muscular cells. It can also be a pathologic condition that leads to hypertrophy of cells. So say you have chronic hypertension, so high blood pressure in your arteries for years. Well, the poor left ventricle of the heart has to pump blood into the aorta where the patient has hypertension. So the left ventricle has to pump to higher pressures to get the blood out of the left ventricle and into the aorta. And gradually over time, it leads to ventricular hypertrophy, left ventricular hypertrophy. And we can see that when we do an electrocardiogram on someone. So that's just an electrical readout of a patient's heart. And we can see if someone has left ventricular hypertrophy on the ECG. Okay? And why have the cells enlarged, hypertrophied? Because they're having to pump against much higher pressures. Okay? Hypertrophy can also be a compensatory mechanism, meaning in this example, loss of one organ, when you have two, of course. So say, for example, a kidney. So someone has had to have their kidney removed because they had a kidney cancer. So the whole kidney has been removed, which is called a nephrectomy. So the remaining kidney that has all of its nephrons, each kidney typically has 1 million nephrons in it to do all of its filtering. Well, they're going to hypertrophy. They have to filter more blood. They have to work harder to get rid of the waste in the body. Okay, so you'll have compensatory hypertrophy of the nephrons to make up for the loss of the other kidney. Okay, so let's do this question together. You're caring for a patient who has COPD, so chronic obstructive pulmonary disease. So that's a condition that is typically due from chronic smoking and sometimes from pollution that has led to destruction of your alveoli and impaired gas exchange. Okay, so CO2 is having difficulty leaving the blood, going into the destroyed alveoli, and oxygen that's been inhaled is having a difficult time going from the alveoli into the bloodstream. Okay, so not only have the alveoli been destroyed, but the blood vessels that go around the alveoli to perform the gas exchange, the CO2 and the O2, they're also being destroyed. And those blood vessels have come from the right ventricle, the right side of the heart, to be oxygenated and to give off the CO2. Okay, so as those blood vessels become destroyed, it's harder for the right ventricle to pump blood through the lungs because more and more of the blood vessels are becoming scarred and destroyed. Okay, so the right ventricle now has to pump much harder in order to force blood through scarred and damaged blood vessels on its way through the lungs and then to return to the left atrium. Okay, so when we look at a heart with an echocardiogram, which is a ultrasound of the heart, we look at the chambers, and if we see that one chamber is hypertrophic or thickened because of enlarged cells, we'll ask ourselves, why is this chamber hypertrophic? And in this case, it is from a pathologic cause. It's from a disease state, right? So COPD is a disease, and because it's destroying the alveoli and the blood vessels that are coming from the right ventricle, and they're becoming scarred and damaged, the right ventricle is working harder and pumping harder so the cells thicken and enlarge. So it's from a pathologic cause that's causing the right ventricle to have myocardial enlargement, okay, or myocardial cell enlargement. It's also a compensatory cause as well. So the cells are getting bigger because they're having to pump harder. So I would say B or C would be correct in this case. So yes, there is an underlying pathological cause. It's COPD. And yes, the right ventricle is having to pump much harder and against higher pressures to force the blood through the lungs. So it's compensatory. Okay, I hope that makes sense.